Isaac, so good to see you. Thanks for being with us today.
My pleasure. Great to see you as well, Michael.
Listen, I want to begin with your reaction here because as you heard, and really as you know, there is pressure to drop this app. Is this a risky move in any way?
I really don't think it is. I think a lot of these policies, especially related to travel, certainly many of them had their place and time earlier on in the pandemic, but I think it's also fair to acknowledge we're in a much different place right now. And I think the sun is setting on several of these policies, including the Arrive Can app. I think we have to ask ourselves, what is it that we're trying to do with this? What is the goal? Is this to keep COVID out of Canada? Because we have plenty of COVID in Canada, unfortunately. I just don't think the app right now is really achieving what its intended purposes are, and that's okay. It just means you have to lift that policy and move along.
Okay, move along, but it's not just the Arrive Can app, it seems, because it seems that the app itself is just one component. As reports have it, though, we're also going to be looking at the end of randomized testing on arrivals. That's going to go. So what do you make of that?
I think the randomized testing, just calling it how it is, it doesn't sound like it's been implemented as smoothly as it could have been. People get tested, and we've heard many reports of people having to find testing sites that are distant from the airport. It was very cumbersome, and it just doesn't really achieve the stated goals as well. There are pilot projects that are running in Toronto and looking like they're going to expand elsewhere, where they're going to do wastewater surveillance for incoming aircrafts and airports. And again, that's a less expensive way to answer the exact same questions. You can really track variants of concern that are emerging and that are entering the country. And that's just a very helpful way to address that issue without inconveniencing travelers.
Okay, and I'm going to pick up on a point that you said, if it's no longer working, move on. So were these measures really to try and control border entry, were they ever useful? Because really in the early days of the pandemic, as you know, the government was hesitant to bring in any kind of border measure. And as the pandemic evolved, as the public outcry grew louder, it was then the Arrive Can app and other measures that came about. So were they ever useful?
It's hard to say, and I think we need to study this, and we need to actually critically evaluate this. But it's pretty clear that earlier on in the pandemic, when we were dealing with the ancestral strain that emerged from Wuhan, or the Alpha variant, and even to some extent the Delta variant, 2 doses of a vaccine would very significantly reduce one's risk of getting the infection and transmitting the infection to others. Now, a lot of that, unfortunately, has been lost in the Omicron era. I still say that the vaccine does a remarkable job in protecting people against severe infection, but it just doesn't do the same degree as it once did in terms of protecting us against getting the infection and transmitting the infection. So these policies could have at least slowed down some of the spread of COVID, not stop it, but maybe slow it down a little bit because 2 doses of the vaccine would certainly have prevented incoming travelers from bringing COVID in at that time. It would certainly reduce it significantly. But the Omicron era really changed so many things. We know it's very transmissible. We know 2 doses of a vaccine does very little in terms of protecting us against getting the infection and transmitting to others. And when the virus changes and the science evolves, it's time to update the policy.
Okay, but the pandemic is not over. So when you talk about updating the policy, what is appropriate now? Because as you say, in the age of Omicron, getting it, spreading it, still possible with 2 doses, but it still, prevents the worst of the disease. But what is appropriate right now, given that the pandemic's not over?
I think the appropriate thing to do is really to ensure that vulnerable individuals and at-risk communities get access to the vaccine. There are people that are certainly under-vaccinated that would greatly benefit from a booster vaccine, and we're just not seeing the same degree of uptake in those populations as we should be. We know who lands in hospital. We know who gets sick. We know who succumbs to this illness. It is an older population, namely people over the age of 60, not exclusively, but that group is overrepresented in hospital and sadly overrepresented in those who succumb to this illness. We also know people with underlying medical conditions that put them at greater risk for severe infection are overrepresented in hospital, and we have to do targeted outreach. I think that would go a long way in protecting individuals, protecting communities, and also alleviating a lot of pressure from the healthcare system. What do I mean by targeted outreach? think people can recall back to when first and second doses were going into arms. We had vaccine centers that were in community centers. We had vaccine clinics in houses of worship. We had door-to-door vaccination programs. We had vaccination programs at places of work. We had 24-hour vaccine clinics to accommodate people that worked in different schedules. And we really were taking the vaccine and bringing it to the people rather than bringing people to the vaccine. I think approaches like that, especially for vulnerable communities and individuals, would go a long way.
So, and yes or no on this very quickly. So what you say is focus on building up defenses at home rather than worry about who's actually coming into the country.
I think that's appropriate at this point in time.
Isaac, always good to speak with you. Thank you for this.
My pleasure. Have a great day.
You too.